Blood flow restriction training. What is it? Benefits? Risks? I'm sure many of you have heard of BFR training, also known as blood flow restriction by many trainers, athletes, and cool kids out there. But what exactly is blood flow restriction? Blood flow restriction training is a training and rehabilitation strategy that utilizes an inflatable tourniquet that is applied to the proximal portion of an arm or leg to partially or fully occlude blood flow during exercise. This stimulates muscular adaptations that improve muscular mass and strength, but at lower loads of resistance than one would typically need. It essentially tricks the body to think it's working harder than it really is. For example, according to the American College of Sports Medicine, in order to achieve an increase in muscle size, one must lift at least 70% of their 1 repetition maximum, and anything below this intensity will not produce significant muscle growth. Now, as this may be feasible for some, training following an event such as an injury may make this difficult. This is where BFR training comes in. BFR training will allow a person to achieve muscle hypertrophy without having to lift the typically heavy weight. But is it safe? Are there any contraindications? As with everything, there are possible side effects. For BFR training, these include pain, numbness, nerve damage, bruising, subcutaneous hemorrhage, syncope or rhabdomyolysis. Also, as anticipated, there is concern around the idea of having your blood flow possibly restricted, especially during exercise. Research has shown that BFR training does not negatively impact cardiac output, and may even be beneficial for cardiac conditioning. Appropriate BFR training with aerobic exercise can safely and significantly improve functional capacity. And for high-risk patients, BFR training may be safely used, as there were no noticeable adverse effects found in BFR training combined with aerobic exercise. Overall, BFR training can be found to be beneficial to a variety of patients when dosed properly. However, it is still very important to only perform BFR training with a certified trainer, and not alone. Whilst BFR training is safe for the vast majority, there are some contraindications that must be noted. BFR should not be used on anyone under the age of 12 years. Individuals who are pregnant, or with an open wound or incision, should not participate in BFR training. Lastly, anyone currently, or has a history of clot risk, heart disease, insufficiency, severe or uncontrolled hypertension, diabetes, sickle cell anemia, varicose veins, infection, cancer or lymphedema, should also not participate in BFR training. BFR training may be a suitable training strategy for your recovery. Please consult with your medical provider and trainer prior to any participation in BFR training.